Ulcerative colitis is a chronic inflammatory bowel disease that occurs only in the colon. The lining of one's colon becomes inflamed and may form ulcers. The combination of inflammation and ulceration can cause severe abdominal discomfort and frequent, often uncontrollable bowel movements. There is not one specific cause of ulcerative colitis, but doctors believe there are a few things that can be a significant factor. Doctors believe that it is an abnormal response by the body's immune system. The immune system sometimes mistakes food or other bacteria in the intestines for a foreign substance, so it sends white blood cells into the intestines, which begin attacking the lining of the colon, which causes inflammation and ulcerations. A few other common causes for ulcers in the colon could be stress, food allergies, environmental factors, and genes. Ulcerative colitis comes in phases, where the individual will have periods of remission where nothing is triggering a response, while at other times they will have flare-ups that cause their symptoms to return. The symptoms of this disease are urgency in emptying the colon, abdominal pain and blood in the stool, weight loss, anemia, loss of appetite, low energy, and extreme fatigue, and among children, it can cause growth and developmental delays due to the lack of nutrients being absorbed in the intestines. There is not a cure for ulcerative colitis, only management plans. Doctors can prescribe medication that will keep the colon from being irritated. Other times, in more severe cases, surgical removal of the colon may be necessary. Controlling one's diet can also help reduce the likelihood of a flare-up and is often the most used method of treatment. Psychological support is key for children who are in constant pain to feel supported and not alone in their disease. Ulcerative colitis affects nearly 700,000 Americans. Men and women are equally likely to be affected. 2 out of every 100,000 children ages 10 to 19 are affected, while 20 to 25% of all cases occur in people less than 20 years of age. The implications for teachers that have students with this disease in their classroom are many. Teachers need to communicate with their students that have this disease because students will be very uncomfortable when experiencing a flare-up. Students need to know that their teachers will make sure that they are able to use the restroom when needed, that they will have snacks that are appropriate for their food allergies, and that they are supported in their pain. Students that have ulcerative colitis may be very irritable during a flare-up due to the immense abdominal pain they may experience. Teachers need to recognize when they are no longer able to function at school because of their pain and need to use the restroom frequently and send them home to rest. These students also need to be seated near the back of the class so that they can leave to use the restroom as needed while making as little of a class disruption as possible. They also need a strong relationship with their teachers so that they will be allowed to use the restroom as needed. Teachers also need to have a good parent relationship with the student's parents so that the student can have a change of clothes at school in case of an unexpected bowel movement, hand sanitizer, and their emergency flare-up medication on hand. If the student knows they are well supported, they will feel more comfortable in the classroom setting. emedicine.medscape.com is a website that parents can use to learn more about the disease and be presented with different medication and treatment methods. ccfa.org is the Crohn's and Colitis Foundation of America website. This foundation has information about the disease as well as connections into communities of people who also suffer from this disease. Just Like Me, IBD.org is a site that is a connection site for teens with ulcerative colitis or other IBS diseases. It is a site that offers advice, new treatments, and what things you can do to lessen flare-ups as a young student. This last link is to a video that explains ulcerative colitis and how teachers, parents, and other adults should be prepared to advocate for their students.